So it's a problem around the sides of the joint, either the inner side or the outer side. In this part of the knee and this part of the knee, we've got the main joint between the thigh bone and the shin bone. Perhaps the most common problem that we see here, particularly people in their more senior years, is arthritis. And actually, if you've done a lot of sport over the years, this can come on in your early 40s, early 50s, etc. This is usually a background pain that's been there for a little while, but when you do sport it gets worse. It may swell up after sport, and you may get some clicking or crunching coming from the knee. If this is the case, you really do need to get it looked at and either x-rays or scans, and you probably need to back off anything that causes you discomfort. The knee will respond to some general strengthening exercises and will respond to some pain relief or anti-inflammatories, and it'll often feel a bit better if you ice it after sport. The second thing in these areas of the body is the little shock absorber cartilages, and you hear of people having a torn cartilage. This usually comes on quite suddenly with squatting, twisting, or a bad tackle with football, a skiing injury, something like that. It can give you really sharp pains if you catch yourself in an awkward position and a constant background ache. Your body can sometimes get used to it if you've torn a cartilage, but if it hasn't settled down within 6 weeks of the original injury, again it needs a look, probably a scan, and an appointment. But again, the knee will respond to some generalised strengthening exercises. There's a few other slightly more rare causes, particularly on the outer half of the knee, with something called iliotibial friction syndrome, or ITBFS. And there's some information about this on my website. So really, any of these problems around the sides of the knee would respond to some good strengthening exercises, and you can get some good knee strengthening exercises by clicking on this link.